So some of the things we want to address was, okay, why are we putting out the reports of the designated risk areas for Lyme? What's the clinical presentation? Because this is what you guys would be most interested in. Why don't we support in Canada the use of the U.S. Lyme test and the whole issue about chronic Lyme? So let's start with the designated areas, and because people are saying, well, if infected ticks attach to birds and birds go everywhere, don't we have Lyme everywhere? And the reality is that's not necessarily true. But if you have risk mapping, as I mentioned before, it helps designate where, if you've had a tick bite, where you're more likely to be exposed to Lyme disease. And the bottom line is, if you follow this over time, we see the clinical cases of Lyme and the diagnostic cases in the areas where the ticks are infected. Yeah. Not rocket science. The infection has to come from somewhere. And while the risk of Lyme disease is not zero in non-endemic areas, the likelihood of getting it is close to zero. And the odd tick is going to fall off a bird, but just think about the likelihood of it's falling from the sky. I mean, okay, we've all had, we've been hit by bird shit before, but that's low level. A tick falling. I mean, again, there are actually people who think that ticks fly. They don't. You have to rub up against something to actually get it on your skin, etc. So, hence in the area. So, the passive surveillance that health units do and with the public health lab. So, where they're looking for, do they have the right ticks? If they have the right ticks, are they actually infectious? And then, of course, we use the surveillance system of the reporting that you do to the health unit and the health unit puts in to actually give us the numbers that we actually can talk about. And the problem for that, of course, is when we talk about, early Lyme disease, is that you won't have serologic positivity. So we're now asking you to report suspected cases that you treated because you thought it was Lyme, and yet you don't have a diagnostic test that tells you that definitively. So, this is tick dragging, which is kind of neat. It's not something I've ever done. You can look for some rodents. These are the maps, and you can see the yellow areas where these are sort of hotbeds, mainly along the St. Lawrence River. Ottawa is just now hitting the big time. We just had something in our paper that 20% of the ticks in our area now have Lyme, so now beware. I don't know what happened last year, but whatever. We have a tiny little piece up there in the northwest.